Welcome back to the Morning Blend. Well, are you tired of hiding your legs in the warm weather this summer? I am. Well, you're not alone. Over 25 million Americans are affected by the appearance of varicose veins.
Dr. Deborah Manjoney from the Wisconsin Vein Center MediSpa is here to answer questions about varicose veins and provide the best treatment options available. Nice to have you this morning.
Thank you. Good morning.
I think first it's probably important to understand what they are, because varicose veins, maybe unlike spider veins, are considered a medical problem, right?
That's right, right. I mean, we don't like to have either spider veins or varicose veins, but varicose veins actually can cause symptoms.
Okay.
And varicose veins form because the little leaflets inside the veins that form one-way valves to let the blood go back to the heart and lungs stop working.
Okay.
There's usually a little bit of a genetic predisposition. The veins, don't forget, are the blood vessels that return the blood to the heart and lungs to get recirculated after the oxygen's picked up back down. So the blood's flowing against gravity in your legs.
Okay.
So it's got to go back up to the heart.
What does this diagram show?
Well, this diagram shows how the vein can stretch out once it's holding more blood than it should. If the blood can't empty properly from the vein, then the vein can get all stretched out, and that's when we start to see the bulging.
And that's on the right there in
That's
blue.
correct.
That's a bulging vein.
That
It's
can be a
holding
bulging
more
vein.
blood than it's
That's right. And so it
supposed
stretches
to.
out to try to accommodate all that blood. And
Okay.
and this is just a diagram that shows some branches that come off the main trunk, because usually the problem starts in a trunk vein, usually the great saphenous vein on the inside of your leg, and then any branches that drain into that vein start getting the back pressure too, because the trunk vein is overfilled. And that's really where you see the varicose veins, because they're closer to the surface then.
And you see a lot behind the knee too, right?
You can see a lot behind the knee, and the ones behind the knee may be truly from another trunk, the small saphenous vein behind and its branches, or they may be just enlarged smaller veins, because it's not uncommon to have those behind the knee. And they can actually give symptoms, but that may not be a varicose vein or a medical problem.
So if you're kind of confused, you're thinking, well, I've got some veins that look like they're kind of bulging, or you can see them through the skin more. How do you diagnose varicose veins?
The way we diagnose this is actually with an imaging study called ultrasound. And so everyone knows, you've had ultrasounds before babies, and lots of people know it's a painless test. We do it with the person standing up. It's very important to see the effects of gravity to know what's going on in these veins. And so with a person standing, we do an ultrasound evaluation of the veins in their legs, and we're able to demonstrate which veins are working properly and which ones are not. If the blood is going backwards or refluxing after we do a little bit of a compression on the leg, it shows the blood's not emptying properly from the vein.
What are some of the symptoms that someone might
The
have?
symptoms are very important to know, because a lot of people don't realize that it could indicate they've got an underlying vein problem, a venous disease. And the symptoms can be anything from aching and fatigue in the legs, especially when you're standing for prolonged periods of time, to itching of the skin after you've been standing or running or doing any kind of activity, a rash around the ankles, discoloration around the ankles, leg cramps at night. People don't realize when they wake up with leg cramps, very frequently it's because they've got too much blood that's been held in those veins all day.
What about people who have
also?
Charlie horse?
Yes, Charlie horse in the middle of the night very often can be from an underlying vein problem.
Okay.
And even the restless leg syndrome. Probably 30 to 40% of people who have restless leg syndrome have it because they've got too much blood in those veins. The blood is just pooling there, not emptying well, and that's what's causing the symptom.
I just noticed we're all sitting with our legs crossed. Is that a myth or is that real?
No, you probably should not be sitting with your legs crossed.
So we're all like, well,
If you have problems, especially behind your knee, and spider veins, it can indeed make them come out and worse. And also, if you're crossing your legs and you have a problem in the lower leg with the veins not working, the trunk veins, it can again prevent the blood from emptying even more, because you're putting compression on the back of that vein on the leg, and so you're preventing the blood from leaving quickly. One thing people should always do if they're sitting for long periods of time is to exercise the muscles in the calf. Flex the feet, get up, move around as much as possible, on an airplane especially, because we want to empty the deep veins, which are underneath the muscles, that aren't usually the cause of varicose veins, but it helps to empty the legs in general.
What about treatment?
Treatments today are fantastic, and that's what we do. We do all minimally invasive procedures in our office. So within an office setting, we are able to do the kinds of things that people had accomplished with vein strippings to remove those veins over the many years before.
This is unbelievable, this picture. This is really amazing. This is a before and after.
That's correct.
Of a procedure you did.
Yes, and what we do for when the trunk vein is involved, what we're able to do is just numb the skin up, puncture into the vein using ultrasound to guide us and thread a little laser fiber up inside the vein. Now the laser fiber is about the size of a raw spaghetti in diameter. And so we're able to position it where we want, see everything with ultrasound, then inject numbing medication, and then we're able to fire the laser as we withdraw it and close the vein off.
Wow. Well, I think the moral of all this is that you don't have to live with varicose
You do not,
veins.
absolutely not. You can walk in and walk out after the procedure about 25 minutes later, half an hour later, and be able to go back to normal activities.
And wear your shorts again.
That's right.
Here's the information for the Wisconsin Vein Center MediSpa. It's located on Georgetown Drive in Pewaukee. The number on your screen, if you want to call to get more information on varicose veins or any of the procedures they do, is 262-746-9088. You can also visit their website, which is wimedispa.com. Thank you so much for being here, Doctor.
Thank
Always
you very
informational.
much. Well, it's great to try to educate people about their problems they might have in their legs.
I agree. Thank
Very
you so
helpful.
much.